Thank Dr. Tong. Dear Chairman and colleagues, to be continued, I would like to invite Dr. Nguyễn to present the topic, result of predicting coronary artery stenosis of framingham score in patients with suspected coronary artery disease at Cần Thơ University of Medicine and Pharmacy. Please.
Dear Chairman, I would like to see you in Vietnamese hypertension Congress report. I would like to show you about the prediction of coronary artery stenosis of Framingham score in patients suspecting coronary artery disease at Cần Thơ University of Medicine and Pharmacy. My name is Quest. I'm a team leader of this research. The first one, I want to show the reason why we do this study. Nowadays, we know about the coronary artery disease is one of the top pathology leading to death from cardiovascular causes. The prediction of coronary artery disease has many models that have to stratify cardiovascular events. That is true of main causes we do this study. The second one I want to show about the subsets and methods. We do in 96 patients were diagnosed with angina pectoris and were indicated percutaneous coronary angiographies. The research address we do in cath lab at Cần Thơ University of Medicine and Pharmacy. The duration we do from 2019 to 2020. The criteria of this group, that means we choose the patient show the angina pectoris and the patient with the electrocardiogram under STT Schumann depression more than 0.5 millimeter into consist to precardialis or typical necrosis QWAS. And the patient must have the echocardiography show the decreasing of dynamic according to coronary suppressions, and they have positive electrocardiogram exercise. We do not do in the patient had the history of coronary interventions or bypass surgery, and the patient with the acute coronary artery syndrome. The research criteria, we want to know about the characteristic of story about the age, gender, risk factor of coronary artery disease, and the damage of coronary artery through angiotherapies. We want to know about the ratio of Framingham square element, the values of Framingham square in predicting in coronary infarctions. The coronary artery stenosis is significantly meaningful when levels of stenosis is more than 50%. And I want to show about the study protocol. We do in 96 patients had coronary artery disease. After that, we ask Simon about the clinical and patient history, and during blood test and Framingham score. After that, we do coronary angiography in cath lab. After we use static software, we have the conclusion about the research. The first one of reasons I want to show about the proportion of elements in Framingham square. The average is 64, and the hypertension of the ratio is 85.41%. The diabetes had the ratio value is 18.75%. Male had a number more than female with the ratio value is 61.46%. The patient has smoking is 48.96%. When we want to test the proportion with and without coronary artery stenosis, the patients have the narrow of artery disease with 76%. When we test the distribution of Framingham square characteristic, when the Framingham square is less than 10%, we have the non-coronary artery stenosis group more than the coronary artery stenosis group with the ratio is 73.9%. And when the Framingham scale is more than 20%, we have the coronary artery stenosis group in more than non-coronary artery stenosis group with the ratio values is 31.5%. When the cutting point of Framingham scale in diagnosis of coronary artery obstruction is 17.5, we have the AUC value is 0.74, and we have the sensitivity is 39.7% and specificity is 95.6. The p-value is 0.001. This is the picture I want to show about the rocker with the AUC is 0.74. And the next one, when we test the cutting point of Framingham scale in diagnosis of 3-branch coronary artery obstruction, we have 13.5 with the AUC is 0.78, and we have the value of sensitivity is 46.2 and specificity is 90.4. This is the second picture of the rockers when we have the Framingham scale with cutting point is 13.5 with the AUC 0.78. In my conclusion, I want to show about the proportion of hypertension and lipid disorder is the most in my studies, and the cutting point of Framingham score in diagnosis of coronary artery injury with the cut point is 17.5 and the rocker is 0.74. When we diagnose of 3-branch coronary artery disease, we have the cutting point is 13.5 with the rocker is 0.78. And the last one of conclusion, I want to show about the Framingham scale applicable and reliable in estimating coronary injury in patients suspecting coronary disease. That's all of my speaker. I would like to share your opinion in my speaking. Thank you.
Yes. So thank you for presentation of Dr. Nguyễn Khuê. So I see that some in this word you must mention, you must pay attention. That's a myocardial infarction and coronary artery stenosis. So you pay attention about using some English word. And the next you should invite or introduce some table about the Framingham score for the audience to see clearly about the content of your presentation. And so I'd like to ask you just one question. That in your study you use the Framingham score, but now you know that the newest score from the European Society of Hypertension 2021, and they use score 2 and score 2 opt older person. So you plan to or you think of how to use the score 2 or score 2 opt to apply the cut upon to predict the coronary stenosis.
Dear Chairman, thank you for question of Professor Hoàng Anh Tiến. I would like to explain more about my research in this study. First of all, I do this study in patient with health CAD disease. That means we choose in the patient health engineers. But in this my report, my present thing, I do not show the detail of Framingham scale when we test in a patient. We do in this study, we had the limits of the age of patient. We do not do in the patient have the age older than 70 years, because this age is very difficult, do not clear to evaluate the Framingham scale. And in this study, we do not do in a patient have coronary syndrome. This is the exclude criteria of my studies. And on the second question, I do not clear, but please ask me again.
Just one question. I said you use score 2 and score 2 opt is older person for the applying to predict the coronary stenosis. You any comment or you plan to use the score 2 or score 2 opt? So please.
On my study, when the patient had a diagnosis of CAD disease, we do angiography. After that, we have the result of coronary angiography. After that, we check the Framingham scale and we do the test of the AUC. After that, we have the rocker, had the coupon of the Framingham scale.
Okay, so thank you for your answer. So you maybe you will study applies the score 2 and score 2 up in the near future. Thank you.
Dear Professor Chairman, now we come to the class presentation. I would like to invite Dr. Lê Thông Tố Anh with the presentation hypertension training result among others in Thừa Thiên Huế province. The MMM campaign from 2017 to 2019.